anyone that works in the healthcare industry, it's a common consensus that there is one element that defines how your day will go for better or worse: staffing. I'm certain you've heard the old adage of quality over quantity, and that certainly applies to the patient mix we as nurses work with. When 3 acute patients can feel like 8 or 9 patients, you need acuity-based staffing. We are going to explore some of the benefits and challenges associated with an acuity-based staffing scenario. What is acuity-based staffing? According to an article in the journal Nurse Leader, it's defined as a model that recommends optimal staffing levels based on patient acuity rather than number of patients, that factors in the amount of time each individual patient will need. Let's think about some nursing ratios. Where I live, it's not uncommon to see 1 to 6 on a med-surg floor, but it can fluctuate depending on the day. Now let's say those 6 patients are some of the sickest patients on the floor, and they're all yours for the shift. Suddenly 6 patients seems insurmountable. Now that we know what we're talking about, let's examine some of the advantages of this model. Staff satisfaction will increase when acuity-based staffing is utilized. Knowing you will have the staff to take care of the patients will lead to decreased stress and increased job satisfaction. Peace of mind lies in knowing that patients will receive high-quality care, which leads us to the next benefit of acuity-based staffing: improved patient outcomes. Being able to spend more time with patients allows us to detect changes in baseline quicker and provide more education at the bedside, leading to a decrease in patient mortality and morbidity. A study examined in an article of the Journal of Nursing Administration noted data of 2,531 patients admitted to 7 medical units and 10 surgical units in Thailand revealed the ratio of total nurse staffing to patients was significantly related to a decrease in hospital mortality. Along with all of these benefits to patients and staff, acuity-based staffing also adds to savings for healthcare systems through improved patient outcomes and staff satisfaction. That sounds great, you say. However, there are some challenges associated with this as well. The first challenge is implementing a system to accurately measure acuity in a framework that is easily replicated and consistently followed on a day-to-day basis. In this model, a lot hinges on having staff that are willing and able to be flexible and understanding, as it will require at times the staff to center their lives on the changing needs of the facility. In summation, there are challenges to the acuity-based staffing model, but the benefits outweigh them. Acuity-based staffing is the staffing model of the future.